Have you ever stopped to think that the way you go to sleep tonight could quietly become the most dangerous risk to your life tomorrow morning? I'm not saying this to scare you. I'm saying this to wake you up to the truth before it's too late. Modern medical research and neurological science clearly show that 1 out of every 3 strokes worldwide occurs either late at night or within the first few hours after waking up in the morning. And what's truly shocking is this. In most of these sudden strokes, the cause is not extremely high cholesterol, not long-term diabetes, not sudden emotional stress, and often not even missed medication. Instead, there is a silent and invisible enemy at work, one that we repeat every single night without realizing the danger. The way you sleep, and what happens inside your body during those long hours of sleep that most people never think about. There is no need to panic, but understanding this truth could literally save your life. A real case that changed everything. Just last month, a nearly 70-year-old man walked into my consultation center. He was energetic. He took morning walks regularly. He ate on time. His diet was balanced. His blood pressure and cholesterol were well controlled. No one in his family ever imagined that someone who looked so healthy could wake up one morning unable to speak properly, with one side of his body completely numb. There was no warning, no pain, no signal the night before. When we analyzed his condition deeply and reviewed all medical tests, one shocking truth came forward. Not genetics, not diet, not lifestyle during the day. The real cause was years of improper sleep posture and dangerous nighttime habits. Habits that silently created pressure inside his brain night after night. Before we go further, I warmly welcome you to Vital Life for Seniors, a channel dedicated to protecting your health with science-backed, life-saving knowledge. Today, we are going to talk about dangerous sleep habits that place intense pressure on your brain and heart throughout the night, and often reveal themselves as a devastating stroke in the morning. Stroke is not a sudden accident. Most people believe a stroke happens suddenly, without warning, but the truth is very different. A stroke is the final result of a long process. After the age of 50, our blood vessels gradually lose flexibility. Blood becomes slightly thicker at night. The brain becomes more sensitive. This is the time when the body should be in deep recovery mode. But if during sleep, your neck or chest is under abnormal pressure because of poor sleeping position, your blood pressure can spike suddenly. That small change can block blood flow to the brain or force a weak vessel to rupture. You may not control when you fall asleep, but you absolutely control how you sleep. And that position decides whether your brain stays protected or quietly moves toward danger. 5 most dangerous sleeping habits. Number 1. Sleeping completely flat without a pillow. Many people believe sleeping without a pillow is good for the spine, but after age 50, especially if you have blood pressure or breathing issues, this position can be dangerous. When your head is level with or below your heart, gravity pushes blood toward the brain. With age, brain vessels become fragile. This increases intracranial pressure and restricts oxygen flow. Many patients report waking up at night with headaches or dizziness, early warning signs of microstrokes. Solution? Use a medium-height pillow, keeping your head 15 to 30 degrees elevated. Number 2. Sleeping on your right side. Most people never consider which side they sleep on, but anatomy matters. When you sleep on your right side, your body weight compresses the inferior vena cava, the main vein returning blood to the heart. This forces the heart to work harder. Since the heart sits slightly on the left side, right side sleeping pushes it against the chest wall. For seniors, this can disturb heart rhythm and increase nighttime cardiac stress. Solution? Sleep on your left side, the safest position for heart and brain. Number 3. Using multiple high pillows. Many people stack 2 or 3 pillows thinking it helps breathing or acid reflux, but excessive elevation bends the neck unnaturally and compresses the vertebral arteries that supply oxygen to the brain. Over time, this causes neck stiffness, morning dizziness, and increases the risk of silent strokes. Solution? Use a pillow that keeps your neck neutral and aligned. Number 4. Sleeping curled up tightly like a fetus. This position may feel comforting psychologically, but physically it restricts lung expansion. Less oxygen enters the bloodstream. The heart must work harder overnight. Tight curling also compresses neck and shoulder nerves, reducing blood flow to the brain. Solution? If side sleeping, keep legs slightly relaxed and place a thin pillow between the knees. Number 5. Sleeping immediately after dinner. After eating, blood shifts toward the digestive system. For seniors with narrowed arteries, this reduces blood flow to the brain during sleep. Alcohol with dinner worsens the risk by causing sudden vessel dilation and blood pressure fluctuation. Solution? Maintain at least a 3-hour gap between dinner and bedtime. Take a light walk before sleep. The 2 safest sleeping positions. Number 1, sleeping on your left side. Number 2, sleeping on your back with the upper body elevated 15 to 30 degrees. These positions support the brain's glymphatic system, the nighttime cleaning mechanism that removes toxic proteins from the brain. They also improve breathing, reduce snoring, and stabilize blood pressure. Final message. Sleep is not just rest, it is cellular repair time. If you wake up with numbness, blurred vision, or sudden dizziness, never ignore it. Small changes in sleep habits can prevent life-altering strokes. At Vital Life for Seniors, our mission is simple: to help you live longer, stronger, and safer with dignity and clarity. Your heart and brain are priceless. Protect them, starting tonight.